If you're a man over 60 dealing with declining energy, frequent muscle aches, concerns about kidney function, recurring urinary tract issues, or just that general sense that your body isn't bouncing back the way it used to, I need you to stop what you're doing and listen very carefully. Because what I'm about to share involves something so simple, so accessible, that you can start implementing it within the next hour. And the science behind why this works is absolutely fascinating. I'm Dr. Nerita. I've been a urologist for 12 years, and in that time, I've helped thousands of men navigate the health challenges that come with aging. And here's something that's become increasingly clear to me through both research and clinical experience. Your body's pH balance, specifically whether your internal environment is too acidic, plays a far more significant role in how you feel, how your kidneys function, how your muscles perform, and how your urinary system operates than most doctors ever discuss with their patients. And there's a remarkably simple intervention that can help support a healthier pH balance, reduce excess acidity, and potentially improve multiple aspects of your health: drinking bicarbonate water daily. Now, I know what some of you might be thinking. Bicarbonate water? That sounds too simple to actually matter for something as complex as aging and health. But stay with me, because the biochemistry behind this is compelling, and the practical benefits men experience when they understand how to use bicarbonate water properly can be genuinely significant. Before we dive in, do me a quick favor. Hit that like button right now. It helps other men who need this information find it. Drop a comment below and tell me where you're watching from. I genuinely love connecting with you. And if you haven't subscribed yet, go ahead and click that button, because I share practical, science-based health guidance every single week. Now, let me explain why bicarbonate water matters and how it could genuinely improve how you feel every day. Let me start by destroying the biggest misconception that keeps men from understanding how their body's acid-base balance affects their health. The myth is this: your body's pH is automatically regulated perfectly by your kidneys and lungs, so there's nothing you need to do nutritionally to support healthy pH balance. That's not just incomplete, it's preventing men from accessing a simple intervention that could address multiple health concerns simultaneously. Here's what I've learned from 12 years of clinical practice and staying current with nephrology and metabolic research. As you age, particularly after 50 or 60, your kidney's ability to excrete acid and maintain optimal pH naturally declines. Combined with modern dietary patterns that create significant acid load, many older men exist in a state of chronic low-grade metabolic acidosis, and this contributes to muscle wasting, reduced bone density, kidney function decline, fatigue, and increased inflammation. Let me explain what this actually means in practical terms. Your body constantly produces acids as byproducts of normal metabolism, from breaking down proteins, from cellular energy production, from various biochemical processes. Your kidneys are supposed to excrete these acids and maintain your blood pH in a very narrow, healthy range. When you're young and your kidneys are functioning optimally, this works beautifully. But as kidney function naturally declines with age, which happens to everyone to some degree, acid excretion becomes less efficient. Add to this the fact that modern Western diets are heavily weighted toward acid-producing foods, meat, cheese, grains, processed foods, and light on alkalizing foods, vegetables, fruits, and you create a situation where your body is constantly struggling to neutralize excess acid. This chronic acid burden creates several problems that specifically affect older men. First, your body will sacrifice muscle and bone to buffer excess acid, pulling alkalizing minerals from these tissues, which contributes to muscle wasting and bone density loss. Second, chronic acidity accelerates kidney function decline, creating a vicious cycle where declining kidney function leads to more acidity, which further damages kidneys. Third, acidic environments promote inflammation throughout your body, contributing to various chronic conditions. Fourth, excess acidity affects energy metabolism, contributing to that persistent fatigue so many older men experience. Now, here's where bicarbonate water becomes relevant. Bicarbonate is one of your body's primary buffering systems for neutralizing acid. When you provide supplemental bicarbonate through bicarbonate water, you help reduce the acid burden on your kidneys, support healthier pH balance, and potentially slow some of the negative effects of aging. This isn't alternative medicine or pseudoscience. This is established nephrology and metabolic biochemistry that has significant practical implications. So, if you've been experiencing unexplained fatigue, muscle weakness, or declining kidney function, and nobody's mentioned pH balance or alkalizing support, you've been missing a potentially important piece of the puzzle. Now, some of you might be skeptical. Dr. Nerita, if pH balance is so important, why hasn't my doctor mentioned bicarbonate water? Why isn't this standard medical practice? Those are excellent questions, and I want to address them directly. The reason most doctors don't discuss alkalizing interventions like bicarbonate water isn't because they don't work, it's because modern medical training emphasizes pharmaceutical interventions and disease management rather than nutritional biochemistry and metabolic optimization. Most doctors are trained to diagnose diseases and prescribe medications. We're not typically trained to identify and address subclinical metabolic imbalances like mild chronic acidosis that don't yet constitute disease, but significantly impact quality of life. But in my 12 years of practice, I've made it a priority to understand not just how to treat urological diseases with medications and procedures, but how to support the underlying metabolic and biochemical conditions that allow optimal function. And acid-base balance is absolutely fundamental to that. This isn't fringe science. Research in nephrology journals has documented that bicarbonate supplementation slows the progression of chronic kidney disease, alkalizing interventions reduce muscle wasting in older adults, supporting healthy pH helps maintain bone density. Reducing acid burden can improve energy metabolism and reduce fatigue. The evidence is solid. What's lacking is widespread clinical implementation, which is why I'm sharing this information with you directly. I've recommended appropriate bicarbonate water protocols to many patients over the years, particularly those with declining kidney function, recurring urinary issues, or general age-related decline. And the feedback has been remarkably consistent. I have more energy. My muscle aches have decreased. I just feel better overall. Not because bicarbonate water is a miracle cure, but because we addressed a fundamental metabolic imbalance that was undermining their health. So what I'm about to share with you is grounded in solid biochemical science and practical clinical experience. This is legitimate medicine that should be more widely known, but often isn't. The 4 reasons men over 60 should drink bicarbonate water. Reason number 1, bicarbonate water supports kidney function and slows decline. Let's start with the most medically significant reason to consider bicarbonate water, and this one is backed by robust clinical research. Bicarbonate supplementation has been shown in multiple studies to slow the progression of chronic kidney disease by reducing the acid burden that accelerates kidney damage. Now, let me explain why this matters and how it works biologically. Your kidneys have the critical job of filtering waste from your blood, regulating electrolytes, and maintaining acid-base balance. As you age, kidney function naturally declines, typically about 1% per year after age 40. When your kidneys are working to excrete excess acid constantly, it creates ongoing stress and damage to kidney tissue. This accelerates functional decline. But when you provide supplemental bicarbonate, you reduce the amount of acid your kidneys must work to excrete. You're essentially taking some of the burden off your kidneys, allowing them to function more efficiently with less damage. Multiple published studies have demonstrated this effect. In patients with mild to moderate chronic kidney disease, bicarbonate supplementation significantly slowed the rate of kidney function decline compared to those who didn't receive bicarbonate. This isn't theoretical, this is measurable, documented preservation of kidney function. Let me tell you about a patient I'll call Henry. Henry was 68 with slowly declining kidney function, not yet requiring dialysis or anything dramatic, but his GFR, the measure of kidney function, was dropping steadily year over year. His nephrologist started him on oral sodium bicarbonate as part of his kidney protective protocol. Over the next 2 years, Henry's rate of decline slowed significantly. His kidney function stabilized in a way it hadn't before. His kidneys hadn't suddenly healed, but they were no longer being constantly stressed by excess acid burden, which allowed them to function more sustainably. Biologically, bicarbonate supports kidney function by reducing the acid excretion workload, decreasing inflammation and damage to kidney tissue, supporting healthier pH in kidney tubules, slowing the progression of metabolic acidosis that worsens kidney disease. Emotionally, protecting your kidney function means reduced anxiety about potential dialysis or kidney failure, greater confidence in your long-term health trajectory, peace of mind, Knowing you're taking proactive action, maintaining independence and quality of life. Practically, what does using bicarbonate water for kidney protection look like? First, understand that this is a preventive and protective strategy. You're not treating acute kidney disease. You're supporting optimal function and slowing age-related decline. Second, for kidney protection, consistency matters more than large doses. Regular daily intake of modest amounts of bicarbonate creates sustained benefit. Third, making bicarbonate water is simple. Dissolve 1/4 to 1/2 teaspoon of baking soda, sodium bicarbonate, in 8 to 12 ounces of water. Drink this once or twice daily, preferably between meals. Fourth, if you have existing kidney disease, work with your nephrologist on appropriate bicarbonate dosing. More isn't always better, and individual needs vary. And fifth, combine bicarbonate support with other kidney protective strategies: staying well hydrated, managing blood pressure, controlling blood sugar, eating appropriate amounts of protein, avoiding nephrotoxic medications when possible. The key insight: by reducing the acid burden on your kidneys through bicarbonate supplementation, you support healthier kidney function and potentially slow age-related decline. Reason number 2, bicarbonate water helps preserve muscle mass and strength. Now let's talk about the second major reason bicarbonate water matters for men over 60, and this one directly affects your functional capability and independence. Chronic metabolic acidosis, the mild excess acidity many older men experience, contributes to muscle wasting and weakness. Bicarbonate supplementation helps preserve muscle mass and strength by reducing this acid-driven muscle breakdown. Here's the biology behind this, and it's important to understand. When your body is dealing with excess acid and your kidneys can't excrete it all efficiently, your body must buffer that acid somehow. One of the ways it does this is by breaking down muscle tissue to release amino acids that have alkalizing properties. In other words, your body sacrifices muscle to neutralize acid. Over time, this chronic process contributes to the age-related muscle loss called sarcopenia. You're not just losing muscle because you're aging, you're losing muscle because your body is using it as an acid buffer. Research has shown that older adults with mild metabolic acidosis experience more rapid muscle loss than those with normal acid-base balance. And importantly, bicarbonate supplementation has been shown to reduce this muscle loss. In one notable study, older adults who received bicarbonate supplementation maintained muscle mass better than those who received placebo, even when calorie and protein intake were controlled. The bicarbonate didn't magically build muscle. It prevented the muscle breakdown that was happening due to chronic acidity. Let me tell you about a patient I'll call Edward. Edward was 72 and experiencing what he described as accelerating physical decline. His muscles felt weaker. He was losing the ability to do activities he'd always managed. He felt like he was aging rapidly. His diet wasn't terrible, but it was acid-heavy, lots of meat and grains, minimal vegetables. We made dietary changes toward more alkalizing foods and added bicarbonate water daily. Within 2 months, Edward reported feeling noticeably stronger. His endurance had improved. Activities that had been becoming difficult felt manageable again. His muscles hadn't suddenly grown, but they'd stopped being sacrificed to buffer excess acid, which allowed them to function and respond to use more effectively. Biologically, bicarbonate preserves muscle by reducing the need for muscle breakdown to buffer acid, supporting better protein synthesis in a more alkaline environment, allowing muscle cells to function more efficiently, reducing inflammation that contributes to muscle degradation. Emotionally, maintaining muscle mass and strength means preserving independence and capability, greater confidence in physical activities, reduced anxiety about frailty and dependence, maintaining dignity and autonomy, better overall quality of life. Practically, using bicarbonate water for muscle preservation involves, first, recognizing this as one component of a comprehensive muscle maintenance strategy. Bicarbonate alone won't build muscle, but it prevents the acid-driven breakdown that undermines your efforts. Second, combining bicarbonate support with appropriate strength training and adequate protein intake. You need the stimulus, exercise, and the building blocks. Protein, along with the alkaline environment, bicarbonate. Third, consistency over time. Muscle preservation happens through sustained metabolic support, not quick fixes. Fourth, starting with modest doses. 1/4 teaspoon of baking soda in water once or twice daily is often sufficient for muscle protective effects. And fifth, paying attention to overall dietary patterns. Bicarbonate water helps, but also shifting toward more vegetables and fruits, alkalizing and moderating excessive meat and grains. Acidifying amplifies benefits. The core message: by reducing chronic acidity through bicarbonate water, you help preserve the muscle mass and strength that maintain your independence and capability. Reason number 3, bicarbonate water reduces fatigue and supports energy metabolism. Now we're moving to the third reason bicarbonate water matters, and this one affects how you feel every single day. Chronic acidity affects your cell's ability to produce energy efficiently. By supporting healthier pH balance through bicarbonate water, many men experience noticeable improvements in energy levels and reduction in that persistent fatigue that seems to come with aging. Here's the biochemistry behind this. Your cells produce energy through a series of complex reactions in your mitochondria, your cellular power plants. These reactions function optimally within specific pH ranges. When your body is chronically acidic, even slightly, these energy-producing reactions become less efficient. It's like trying to run an engine with slightly contaminated fuel. It works, but not as well as it should. The result is that your cells produce less ATP, your cellular energy currency, for the same amount of fuel. You experience this as persistent fatigue, reduced stamina, slower recovery from activity, and that general sense of running on empty. Additionally, acidic conditions increase levels of inflammatory markers, which themselves contribute to fatigue and that sick feeling even when you're not actually ill. When you support more alkaline pH through bicarbonate supplementation, cellular energy production becomes more efficient. You're optimizing the environment in which your energy metabolism occurs. This isn't a stimulant effect. You're not artificially boosting energy. You're removing a metabolic obstacle that was preventing efficient energy production. Let me tell you about a patient I'll call William. William was 69 and describing absolutely crushing fatigue that had developed gradually over several years. He'd undergone extensive testing, thyroid, anemia, heart function, everything came back normal. When we evaluated his metabolic status and implemented alkalizing strategies, including bicarbonate water, within 3 weeks, William reported feeling noticeably more energetic. Within 2 months, he described feeling like myself again. His mitochondria hadn't multiplied, but they could function more efficiently in a properly balanced pH environment. Biologically, bicarbonate supports energy by optimizing the pH environment for cellular energy production, reducing inflammatory markers that cause fatigue, supporting more efficient oxygen utilization, allowing metabolic enzymes to function optimally. Emotionally, improved energy means ability to engage in activities you value. Better mood, energy, and mood are intimately connected. Greater sense of vitality and capability, reduced frustration about physical limitations, enhanced quality of life overall. Practically, using bicarbonate water for energy support involves: first, understanding that this addresses underlying metabolic efficiency, not acute energy needs. You won't feel a sudden boost. You'll notice gradual improvement in baseline energy levels. Second, consistency is key. Daily bicarbonate water creates sustained pH optimization that allows consistent energy improvement. Third, timing can matter. Some people find taking bicarbonate water in the morning supports better energy throughout the day. Fourth, combining pH support with other energy strategies: quality sleep, appropriate exercise, stress management, adequate hydration, blood sugar stability. And fifth, giving it adequate time. While some people notice energy improvements within days, for most, it takes 2 to 4 weeks of consistent use. The key message: by supporting optimal pH for cellular energy production through bicarbonate water, you address one of the hidden causes of persistent fatigue. Reason number 4, bicarbonate water may reduce urinary tract issues and kidney stones. Finally, let's talk about the fourth reason bicarbonate water matters, specifically for men over 60. And this one is particularly relevant to urological health. Bicarbonate water helps alkalize your urine, which can reduce irritation to the urinary tract, make the environment less favorable for certain bacteria, and help prevent certain types of kidney stones. Here's why this matters from a urological perspective. When your urine is overly acidic, which is common when your body is dealing with chronic acid load, several problems can develop. First, acidic urine can irritate the bladder and urethra, contributing to urinary frequency, urgency, and discomfort. Second, certain bacteria that cause urinary tract infections thrive better in acidic environments. Alkalizing your urine creates a less hospitable environment for these bacteria. Third, uric acid kidney stones, one of the common types of kidney stones in older men, form more readily in acidic urine. Alkalizing urine can help prevent these stones and may even help dissolve existing small uric acid stones. And fourth, some chronic prostate conditions involve inflammation that's worsened by acidic conditions. Supporting more alkaline pH systemically may help reduce this inflammation. Now, bicarbonate water doesn't treat acute urinary tract infections or dissolve all types of kidney stones, but it creates urinary conditions that are more favorable for urological health. Let me tell you about a patient I'll call George. George was 71 with recurring urinary discomfort and a history of multiple uric acid kidney stones. His urologist had tried various approaches with limited success. When we tested George's urinary pH, it was quite acidic. We implemented bicarbonate water daily with a goal of maintaining his urinary pH in a healthier, more alkaline range. Over the following year, George's urinary discomfort decreased significantly, and he didn't develop any new kidney stones, a marked contrast to his previous pattern of stone formation every 12 to 18 months. His urinary system hadn't fundamentally changed, but the pH environment had shifted in a way that supported better urological health. Biologically, bicarbonate supports urological health by alkalizing urine to reduce tissue irritation, creating a less favorable environment for certain pathogenic bacteria, reducing uric acid crystal formation, preventing uric acid stones, supporting healthier prostate and urinary tract tissue. Emotionally, improved urological health means reduced anxiety about painful conditions, less disruption to daily life from urinary symptoms, greater comfort and normalcy, reduced need for medical interventions, better overall quality of life. Practically, using bicarbonate water for urological health involves, first, testing your urinary pH with simple pH strips available at any pharmacy to see if your urine is overly acidic. Optimal urinary pH for most purposes is around 6.5 to 7.5. Second, if your pH is consistently below 6, bicarbonate water can help raise it into a healthier range. Third, for urological purposes, taking bicarbonate water twice daily, morning and evening, often produces better pH stabilization than once daily. Fourth, monitor your urinary pH periodically to ensure you're maintaining a healthy range without going too alkaline. pH above 8 can promote different types of stones. And fifth, combining pH support with adequate hydration, crucial for urological health, appropriate diet, and other evidence-based urological health practices. The key insight: by alkalizing your urine through bicarbonate water, you create conditions that support better urological health and may help prevent certain recurring problems. All right, let's take everything we've covered and create a clear, safe, practical action plan for implementing bicarbonate water. Step 1. Determine if bicarbonate water is appropriate for you. Bicarbonate water is generally safe for most people, but it's not appropriate if you have severe kidney disease, your kidneys may not be able to handle the sodium load, heart failure. Sodium retention can worsen fluid retention. High blood pressure that's poorly controlled, sodium content may be problematic, are on a strict sodium-restricted diet. Always consult your doctor before starting bicarbonate water, especially if you have any chronic health conditions or take medications. Step 2. Understand the basic preparation. The simplest method: use food-grade sodium bicarbonate, plain baking soda from the grocery store. Dissolve 1/4 to 1/2 teaspoon in 8 to 12 ounces of water. Stir thoroughly until completely dissolved. Drink 1 to 2 times daily, preferably between meals. Start with the lower dose and adjust based on your tolerance and response. Step 3. Optimize timing. For general metabolic support, take once in the morning and once in the evening away from meals at least 1 to 2 hours after eating to avoid interfering with stomach acid needed for digestion. For urological/kidney stone prevention, twice daily provides more consistent urinary pH support. For exercise performance, bonus benefit: taking bicarbonate water 60 to 90 minutes before exercise can improve performance by buffering acid accumulation in muscles. Step 4. Monitor your response. Track changes over 4 to 6 weeks, energy levels and fatigue, muscle aches and weakness, urinary symptoms if relevant, overall sense of well-being, urinary pH if you're monitoring it. Most people notice gradual improvements rather than dramatic overnight changes. Step 5. Combine with dietary alkalizing strategies. Bicarbonate water works best as part of an overall approach. Increase vegetables and fruits, alkalizing, moderate excessive meat and grain intake, acidifying, stay well hydrated with plenty of water, reduce processed foods and sugars. Step 6. Be aware of potential side effects. Common, usually manageable. Mild bloating or gas usually improves with continued use. Increased urination, you're consuming more fluid. Less common but important. If you experience significant bloating, reduce the dose. If you develop swelling in ankles or feet, stop and consult your doctor, may indicate sodium retention. Never take bicarbonate water with calcium supplements or antacids containing calcium, can cause milk alkali syndrome. Step 7. Consider potassium bicarbonate as an alternative. If you need to avoid sodium, potassium bicarbonate provides the same alkalizing benefits without the sodium. It's available as a dietary supplement. I want to take a moment to speak directly to something many men over 60 experience. The declining energy, the persistent muscle aches, the kidney function numbers that keep creeping in the wrong direction, the urinary issues that disrupt your life, these changes can feel like an inevitable, irreversible slide. Like your body is betraying you. Like there's nothing you can really do except manage decline. And that feeling, that sense of helplessness and resignation is deeply discouraging. But here's what I want you to understand with absolute clarity. Many of the symptoms you've been attributing to just aging are actually symptoms of correctable metabolic imbalances like chronic low-grade acidosis. You are not helpless. You don't have to passively accept fatigue, muscle wasting, declining kidney function, and reduced quality of life as inevitable. Something as simple as supporting healthy pH balance through bicarbonate water, understanding the biochemistry, and implementing it properly can genuinely make a measurable difference in how you feel and how your body functions. This isn't false hope or pseudoscience. This is established metabolic biochemistry that has profound practical implications. And what you're doing right now, learning this information, considering how to apply it, taking action to support your health, that's not desperate grasping at straws. That's informed self-advocacy. That's taking responsibility for your well-being. That's refusing to accept unnecessary suffering as inevitable. Your energy matters, your muscle strength matters, your kidney function matters, your urological health matters, your quality of life matters. And you deserve to feel as vital, capable, and comfortable as possible, regardless of your age. Every action you take to address underlying metabolic imbalances is an investment in your well-being, your independence, and your future. We've covered something genuinely important today: why bicarbonate water, a remarkably simple intervention, can support kidney function, preserve muscle, reduce fatigue, and improve urological health by addressing the chronic low-grade acidosis that affects so many men over 60. You now understand how bicarbonate water reduces acid burden on kidneys and slows function decline, helps preserve muscle mass by preventing acid-driven breakdown, supports better cellular energy production by optimizing